Thank you and good afternoon and welcome to our media advisory for this Friday afternoon. It's been an interesting and hectic week and I'm hoping you're all well. And we'll look forward to some semblance of a weekend this weekend coming up. We continue to work with our federal and provincial partners. The province just announced an expanded list of essential workers eligible for receiving emergency child care. The updated list of eligible workers in emergency care centres is available on the ontario.ca/coronavirus website, so do dial into that for those that are in the emergency care services for eligible child care. The province has added 1,035 acute care beds and 1,492 critical care beds and has taken steps to ensure that hospitals have the staff available to care for a sudden surge in patients due to the COVID-19. So Ontario has a total of 20,354 acute care beds and a potential for an additional 4,205 more acute care beds for the April 30th, 2020 timeframe. That is good news in terms of preparedness, so one can be reasonably confident that we have the capacity needed to deal with the upsurge. The federal infrastructure minister, Minister McKenna, is preparing plans to rush out billions of dollars in budgeted but unspent infrastructure funds as a way to stimulate the Canadian economy, and certainly Hamilton will be front and center in ensuring that we get our fair share to ensure that we also get our economic uplift here in Hamilton when the pandemic is past us. Of course, that's the immediate focus, and we certainly anticipate that that will continue for some time. But they're starting to consult with experts to figure out how to gradually reopen the economy and look for shovel-ready projects that can be approved quickly and create immediate jobs should the decision be made to start opening up our economy. And certainly that is not something that's on the horizon as I understand it, but certainly something that people are starting to think about as we continue to move forward through this crisis. New measures to support Canadian businesses are also in the works, and one of them that is a continuing one, which is the expanding the Canadian Emergency Business Account, which actually expanded its horizon to allow for businesses that paid between $20,000 and $1.5 million in total payroll last year, which actually makes this available to many more businesses out there than the previous criteria that was out there. And it addresses, some of the challenges that are being faced by businesses in our community, and we know they're innumerable, and hopefully this will go some way of providing them the kind of assistance to keep them afloat for the next few months. They introduced the Canada Emergency Commercial Rent Assistance Program for small businesses. This is a program that will provide loans, including forgivable loans, to commercial property owners who in turn will lower or forego the rent of small business for the months of April retroactively and for May and for June. Certainly something that we've been asking about and certainly concerned about the renters in our community on the business side as well as on the individual side. So this is certainly a particular help for the renters that are in business and renting property from others. There's more information on all of that on our city's website at hamilton.ca/coronavirus/financial-support-individuals. So for anyone in business or any individual that's looking to capture how they can get access to and what resources are available to them, you can go to that website and all of that information is there in one location for you to get access to. In terms of the city updates, during Wednesday's City Council meeting, Finance staff presented Council with the current estimated financial COVID-19 impacts on a month-to-month basis, projecting out to at the end of May. The anticipated negative financial impact for the city's response to COVID pandemic is in the order of $22.9 million hit on our operating budget, so a shortfall. To reduce that financial impact on the municipality, and to adhere to the mandated provincial closures as of May 5th, 2020, and then until further notice, we will be discontinuing the scheduling of hours for our part-time employees who are performing work that, while important to the city, is currently considered to be non-essential. Unfortunately, that will affect some 1,200 city employees and represents a savings of approximately $250,000 per week for the municipality. That does not mean that we do not value these employees and their contributions. We absolutely do. But unfortunately, this change needs to be made to ensure that not only do we save some money municipally, but give them the opportunity to provide some of the resources that the federal government has put forward that may benefit them as they go forward through their time. And you know, our intention would be down the road to bring them back and start scheduling hours again. A drive-through COVID-19 additional testing center opened today in partnership with the city and the Hamilton Public Health Services, Hamilton Health Sciences, and St. Joseph's Healthcare. It's located at the Dave Andrechuk Mountain Arena at 25 Hester Street. It will be open from 11 a.m. to 3 p.m. this Friday to Sunday. It's operated by the Hamilton Family Health Team, and McMaster Family Health Team is being staffed by the primary care clinicians. And as all the other drive-in centers, you need a referral from your doctor or a Hamilton Public Health Service clinician is required, and screening and an appointment is required as well before you can actually get testing done at these locations. This is not a drop-in location. This is by appointment only and by recommendation from a doctor or a public health official. We are also announcing today a temporary change to the leaf and yard waste collection. I can hear the cheering out in the broader community already. The temporary program will begin Monday, April 20th. City crews will collect leaf and yard waste bi-weekly in alternating parts of the city. So this is not the same kind of collection we've had in the past. This is an ability to collect some given the resources we have. So beginning Monday, April 20th, yard waste will be collected from homes in Ancaster, Dundas, Flamborough, Glanbrook, and Stony Creek. And beginning the week of April 27th, yard waste will be collected from homes on the mountain and across the lower city. So what will happen is, for this bi-weekly collection, you're asked to put out your leaf and yard waste at the beginning of the week. And sometime through that week, our leaf and yard collection will occur. So it will not be a given day. It'll be sometime when they can get to it, but it will happen. And so this is as much as we can do now, given the resources we have. And I'm sure many people are glad. I know many councillors are, and we've certainly had many calls on this issue. And it's believed that we do have the resources to have this level of collection happening over the next few months. There's no change to the collection of garbage, recycling, and green cart. All of that will continue to be picked up as it has been in the past. And lastly, on March 17th, I should say, 2020, the province declared a provincial state of emergency pursuant to the authority granted under the Emergencies Management and Civil Protections Act. This morning, the Ontario Minister of Municipal Affairs and Housing, Stephen Clark, wrote me a letter to inform me that on April the 16th, the province is issuing an emergency order under the EMCPA to provide municipalities with the flexibility to deploy certain staff to where they are needed most. This order is a temporary measure and provides municipalities the authority to take any reasonable measures necessary to respond to the COVID-19 with respect to the internal work deployment. So to exercise this authority, we are required to declare a state of emergency under Section 4 of the EMCPA concurrent with this order. Now, I must say that we have redeployed staff, and we've done it in cooperation and collaboration with our unions, who have been absolutely terrific through this entire process. This order is a technical matter, and so if we run into difficulties, and I don't expect we will, because again, the cooperation's been terrific, but if we do, then we have an overriding authority to make the changes as required. And so we will remain in a state of emergency, both provincially and now municipally as well. And we thank the province for continuing to work to make sure that all the authorities are in place so that our EOC staff and our public health can make the appropriate changes as required based on this pandemic crisis. And I would say once again to thank all of you for continuing to do the good work that you're doing, staying separated, and being good neighbors to all of our citizens to ensure that we're not continuing the spread of this coronavirus in our community. I think that Dr. Elizabeth will share some stats in a minute, but I'm now going to turn it over to our wonderful emergency operations manager, Paul Johnson, to give us some updates from his perspective. Paul?
Well, thank you very much, Mr. Mayor, and I want to say off the top that we appreciate at the EOC your agreement in signing the local state of emergency declaration. Really, when that letter came from the ministry, we felt it was really important to have that flexibility. We enjoy that, and thank you for taking that recommendation and actioning it. So thanks very much for that. As the mayor mentioned, we are looking at some services. Leaf and yard waste is the first of those, and we've been thinking for the last couple of weeks how we could provide some services in a modified fashion. And I think this is a good example of the work that we're doing day in and day out through the EOC to look at ways that we can deal with things that are going on in our community while recognizing it is simply not possible to deliver all of our services at the same level of service that Hamiltonians enjoy when we're not in this type of crisis and pandemic. So the leaf and yard waste is an example of that, and I can share with you that we are also looking at some other ways that as we move into the spring and closer to the summer, while still in this state of being relatively closed down, that we can continue to provide important services. But as always, we just don't believe there's any service that will simply start up in the way it was prior to this all beginning in March. There are always going to be modifications to them, and we really appreciate the public's taking into account that we're not able to deliver at the same level. So your patience and understanding is appreciated. As I did mention on Wednesday night, some of our construction projects at the City of Hamilton will be halted and put off for just a little bit. Much of the work of the city, though, will continue. And there's been some questions about, why are we continuing with some of these projects? Well, we've prioritized and ranked and looked at these projects, and some, of course, are to keep critical infrastructure going. And that's critically important to make sure that we don't postpone some of that work. So some of those things will continue. And in some cases, we just need to put the work in because we're at risk of losing some funding if we don't do that work. So you will see a number of city projects continuing, and that's not to suggest that we haven't taken the issue seriously about looking at construction projects. We have, and just know that some of them have been postponed and pushed off for just a little bit until we get through this next period of time. Really encouraging local social service agencies and community organizations to visit our COVID website under the financial support section to look at information around new funding that's available, that our staff will be reviewing grant applications in very short order. So they will turn these around in a matter of days and allow organizations in our community who have COVID-19 related activities and pressures on their organizations to allow them to continue to do the work. I will say, much is eligible. The one thing that's not eligible are capital projects. This is meant to deliver service to our community, whether these are increased costs for you to continue to deliver service or to enhance and provide additional service. Could be about staffing, could be about the ways that you need to deliver your service to promote social distancing, all of those things. We recognize at this time community organizations, our not-for-profits and charitable groups are delivering some really, really critical services to those in our community. One additional cancellation to talk about today. Each year, the City of Hamilton and the Dundas Valley Rotary Club Sunrise co-produce a Victoria Day celebration and fireworks in the Dundas Driving Park. And a joint decision has been made to cancel this event, which was to be on May 17th, 2020. So that event will not go ahead. Today, alongside our Housing Services Division, I sent out a letter which will go broadly to social housing providers as well as some of our commercial housing landlords, asking for help, asking for opportunities for us to continue to place individuals who are currently homeless into housing units. We took a bit of a pause during the height of our COVID-19 closures of programming and some of our work around dealing with what was happening in March into early April. But now we'd like to get back on track with helping people who are homeless get a home. We have tools at our disposal, and in fact, kicking off April 1st, approved by council in March was, or in April, sorry, was some new benefits for housing that will allow us to provide a housing benefit that will help make housing more affordable. So this isn't just for social housing providers. We really would like private market rental units that may be available to get in touch with us, and we can help match appropriate people to the housing in our community. And the email that you can reach out to us at is pretty simple, housing@hamilton.ca. So with that, I just want to continue to thank, as I think it's important, we'll have a couple days off before our next time in front of you, is to thank all of the folks who are City of Hamilton employees, as well as our partner organizations, for working so well together to continue to deliver the services that we have, and in many instances, add additional services into our community to help some of the most vulnerable. So well done to everyone who works with us, and of course, all of those who are proud to work for the City of Hamilton. Dr. Richardson?
Thanks, Paul. So just an update on our case counts as of today. We're at 319 cases in Hamilton as of noon today. You may have noticed that there was a fairly significant jump up yesterday. That's because we've started a slightly different approach to testing, particularly in settings where we've been seeing outbreaks. And those are in places like long-term care homes and retirement homes. And all of us through the system, our healthcare partners in hospitals, long-term care homes, retirement homes, we're all very interested in understanding what's happening in those outbreaks. And so we've started to do more testing beyond those that are symptomatic and to include testing of others that are asymptomatic. So you may have noticed as well that on our website, it should be effective today, there's a slightly different breakdown too of our cases. So of those 319, 305 of them are lab confirmed and symptomatic. 14 are lab confirmed but asymptomatic, so they're part of that broader testing. And 5 are probable. So these probable groups are a group that have COVID-like symptoms. They've had an exposure to COVID, so either they're a contact of a case or they may have traveled for some reason or another. But they were not able to be tested. So they're added to the numbers now as well. As always, you can find more details beyond those on the website. Of the 319, 132 cases are resolved, so that's about 41% of cases. We're not including in that the 14 asymptomatic, although you could add those on as well. We are still sitting at 11 deaths in total at this point. We have no new deaths that have been reported today, which is good news. We do have the ongoing 6 institutional outbreaks and 2 community outbreaks. And you may ask us why we don't call them all institutional. It's really just a technicality in terms of how things are classified in our system. So we have the outbreak at Heritage Green, and it looks like we have had 1 new confirmed resident case there. So our staff are working with them to understand that piece. At the Cardinal Retirement Residence, this was the place where we did the first batch of expanded testing and found that overall there were 45 positive residents, which included 26 symptomatic residents that had been picked up already, and then 19 that were further detected with the broad testing of those in the lodge, in the facility. The very good news that we talked about on Wednesday night, which was that Wentworth Lodge's outbreak was declared over, so that is great. St. Joseph's Healthcare in Hamilton, the special care nursery, where we had 3 healthcare workers, that's on track, hope I'm not jinxing it, to be declared over on Saturday, tomorrow. We have the outbreak at Chartwell Deerview Crossing Retirement Residence, and we did undertake expanded testing at that site as well yesterday, thanks to our Hamilton EMS, our paramedic colleagues, who did 38 swabs in that facility. Kingsbury has 1 new confirmed resident in that residence, and we're working with them to look at expanded testing as well. Clarion has no changes in that site. Emmanuel House, the hospice, there are 2 new staff confirmed in that particular outbreak, and again, there believe it was yesterday or the day before, there was expanded testing undertaken there. And finally, within Wesley Supportive Housing, this is a unit in a particular building. They did have one lab-confirmed resident, and so we declared an outbreak there yesterday. So that's the update on all the cases. The mayor has talked about the new DriveThru testing site that has been put together. So we've worked with our partners in primary care, the Hamilton Family Health Team and McMaster Family Health Team, as you spoke about, Mr. Mayor, along with Hamilton Health Sciences and St. Joe's, and of course our very own facilities staff from Public Works have been working together at the Dave Anderchuk Arena at 25 Hester to set up the site. It's a great idea. These are ideas that had been put forward in South Korea previously. They started with it, and some of our colleagues across the country have done something similar. So right now we have a single lane drive-through that goes through the Zamboni door. I've often heard people wanted to drive the Zamboni now. They can't drive the Zamboni, but they can drive through the door and be in the arena. So they do go in. They are assessed by somebody who approaches their vehicle. The person stays in their vehicle, and the swabbing, the assessment is done, and then the swabbing is done if it's indicated. So it's not a guarantee, just like the other assessment sites, that you'll get swabbed if you show up. They do an assessment to look at any symptoms and give you advice related to that, and do the swabbing if it's indicated. You may be wondering if there are certain vehicles that don't fit through. What do we do with those? So we do have plans in place if your vehicle is too large to go in through that route, or for large diesel vehicles, that sort of thing. So do go ahead, call through to our hotline as the mayor's talked about, and you will get booked in and seen in that site. It is still a booking process because we want to, again, keep people moving and move people through. Just to note, if you don't have a vehicle, you can absolutely still be booked into one of the other two assessment centers that continue to operate. You do need that referral or booked through us to enter or to get into any of the three sites. One thing to really remember too is that the provincial testing criteria have changed quite a lot over the past week, and so we have expanded up who is eligible for testing. So, people who are frontline workers, first responders are eligible to be tested, people who are essential workers. So anybody who's continuing to work as an essential service, they are eligible to come in and be tested, whether you're working at a grocery store or a pharmacy. You still need to meet the criteria, as I mentioned, but absolutely they can come through and be tested through these sites. It also includes family members of healthcare workers who are sick, cross-border workers who are continuing to move goods, all of those people. So if you're symptomatic, please do give us a call, and we will work to get you into one of the sites. Our testing numbers have definitely gone up over the last day or so. One thing we do want to note, though, is it is for people who are not well. We have had, unfortunately, a number of people who are well asking to get booked into these sites, and it's because their employer is asking them to get a clearance note to go back to work. That is not recommended at all, and in fact, it's taking up resources that could be used for those who are symptomatic. And so we want to really get the message out that kind of testing, it's not helpful. For somebody who's well, the fact that they have a negative test today means nothing about tomorrow or even 5 minutes after they're tested. And we really want to make sure we reserve those spots for people who are not well and are coming to get tested. I do want to say kudos to my primary care colleagues, to the family doctors and nurse practitioners who are out there doing work in these kinds of settings, in the assessment centers, but also for the very important conversation that was opened up today around the issue of advanced care planning. So some very difficult but necessary conversations that need to happen, particularly right now, knowing that those who are older, over the age of 65 in particular, or those who have chronic medical conditions, are at a higher risk for serious illness and even death. And so having those conversations is really important to do, so that you think through what you would want to have happen in those circumstances, and you communicate those with both your family, people who are closest to you, and think them through together, and communicate them to your family doctor and others that are involved in your care. So thank you very much to our primary care colleagues for getting that conversation started. Back to you, Mr. Mayor.
Okay, thank you, Doctor, and thank you, Paul, and thank you again for your ongoing good work. These are still challenging times, and we thank everyone for maintaining their physical distance and not gathering in groups. It's still very important to do. This is not the time to let up on those issues. It's a critical time to keep at it and maintain that physical separation wherever you are as much as you can, and stay home as much as you can. As you hopefully know by now, that physical distancing bylaw prohibits that activity, and there are bylaw officers out there that will fine you if you don't adhere. The $500 fine can be delivered once you've given some advance warnings, and obviously having people comply is the best remedy, but should they fail to do so, a $500 ticket can be given by our public health officials and by our police officers. So please do adhere and, be part of the team that actually is helping to defeat this virus. What you do and what your family members do and what your neighbors do collectively is going to make all the difference in the world in terms of how we succeed. Some good news stories as of today. I want to give a special shout out to Redeemer University, who donated vital personal protective equipment to frontline healthcare workers. Boxes of vinyl nitrile gloves have been delivered to St. Joseph's Healthcare in Hamilton and West Haldeman Hospital in Hagersville as well. So thank you to Redeemer President Robert Graham and all the folks at the Redeemer University for your thoughtfulness and generosity on that. Very much needed. More PPEs or personal protective equipment is always required, and the more that we get, the better off we are. Shout out to Olivia O'Grady of Ancaster, who has been making special headbands that have buttons sewn on them to help keep the elastics from face masks from rubbing the ears of frontline healthcare workers. It serves as a kind of COVID-19 pandemic mask, which I think is very, very helpful. So Olivia has been making them in the sewing nook in her Ancaster home and is paying for the materials with a special GoFundMe page. So thank you goes out to her. And she is looking for anyone that's handy with a sewing machine. If they're interested in helping out, they could reach her at headbandsforhelpers@gmail.com. Again, that's headbandsforhelpers@gmail.com. Olivia will be happy to get your help and support. And we thank her on behalf of all of our frontline workers for making this helpful innovation. Whitebird is a family-owned company that makes corrugated packaging and sanitation supplies right here in Hamilton. They were asked by Hamilton Health Sciences to see if Whitebird could retool their plant to provide low-cost face shields. And in fact, Whitebird did just that. They retooled and are now supplying Hamilton Health Sciences with 150,000 face shields, and are now also offering those face shields to healthcare providers and first responders right across Canada. So a very positive development indeed for a retooling of a company that is now helping our frontline workers. So a thank you goes out to Hendrik Taminga, president of Whitebird, and everyone on their team. It's very encouraging to see that kind of change and positive outcome and help and assistance to our frontline workers continue to happen in our community. So thank you for all of those good efforts. And on that note, I'm going to turn it over to Jasmine to see if there are any questions from our media, and then we'll close it up.
Thank you, Mr. Mayor. We do have a number of media partners on the phone again today. Just as usual, I'll remind everybody, please keep themselves on mute. One question and one follow-up. We'll start with Joanna from the Hamilton Spectator. Joanna, go ahead.
Hi, thanks for taking my question today. This question is for Paul. Can you give us an update on where the city is at when it comes to PPE?
Yes, I can. We remain in a stable situation. We've got weeks of supplies of some of the critical things. I'm super impressed. I actually had a follow-up call with the three areas where there would be the highest use. Certainly long-term care, paramedics, and fire, where the highest use of PPE is. All are taking good measures to conserve PPE in its daily use. And we talked today about where there are some pressures, but none of those pressures are immediate and causing us for alarm. And that's a credit to the folks that are sourcing this through our supply chains, and also a credit to our frontline workers who are using these in appropriate ways. We're in full masking now at our long-term care facilities as per the directives of long-term care, so none of our workers go without, but we have ongoing conversations about how best to preserve. And little things like our paramedics moved to a different type of mask. It has a longer use. It's the same level of protection as N95s, but they don't go through N95s as quickly this way. It's all of those things that happen that mean that we're there protecting our folks each and every day. So I feel comfortable. The thing you'll hear me say is I'm never comfortable enough because I want to have months of the stuff on hand. But I am very, very comfortable that we've got several weeks of supplies in the critical areas and feeling good about that.
Thanks so much. My next question is for Dr. Richardson. Dr. Richardson, can you talk a bit about the SWAT teams that the province has set up? Like, is public health organizing those? Do you know which Hamilton long-term care homes will get those? Do you know, like, how many hospital workers and how many home care workers are being redeployed? Do you have any information on this yet?
Hi, Joanna. We don't have specific information yet. Absolutely, we've already been cooperating, as I mentioned last time we talked. At the old HNHB Lynn level, we've been working together. Paul's been leading up a lot of this piece as bringing together community providers to look at how we can support long-term care homes and retirement homes. We're working with the hospitals as well. And we've been shoring up these sorts of facilities all along, as you heard about with us, with the Cardinal, and the sorts of work that were done there. So essentially, there's more clarity coming from the province around how they envision these happening. But in the meantime, we're all just working together to make sure that we support these locations, and that will continue on and be modified as any further guidance comes from the province.
Thanks. Next question goes to Samantha from CBC Hamilton. Samantha, go ahead.
Hi there. Thanks for taking my questions. My first question is for Dr. Richardson. I know the city has been ramping up testing this week. Is there any way we can quantify that? Do you know offhand any numbers or any way we can sort of illustrate how much more testing we're doing?
So I don't have it broken down by date. It's funny because the way we keep our data, we keep adding it up rather than keeping it by date, but we're looking to break it out so we can see that. We keep track of what's happening in the assessment centers, and so we know now that we're at 3,119 visits at the assessment centers and 2,533 tests done since we opened them up. We are also doing that testing that I mentioned in the long-term care facilities and other sites. And so I'm just going to go back for 1 second. We know that we did, for example, an extra, I'm trying to add this up in my head as we go. We've tested an extra 19 asymptomatic people within the Cardinal. We did do at Chartwell 38 additional swabs. There was, in collaboration with the primary care docs, they did additional swabbing at Emmanuel House. I don't have the total number that they did. And then we'll be looking at other sites as we go forward. So we'll keep adding those up, and I'll ask our staff to put together a little bit more of a tracker so we can see that.
Okay, thank you. My other question, Mr. Mayor, you mentioned that we're going to need shovel-ready projects to be able to get people back to work. What are some of the shovel-ready projects that we might that might be able to do that in the city?
Well, the first one I would turn to, Sam, is high-order transit. Whatever that ends up being, and obviously my view in terms of LRT, and I think there's no more major shovel-ready project in the city of Hamilton than that one. It's been studied to death. It's been analyzed, evaluated. A lot of the groundwork has been completed. It was a couple of months away from final procurement. I know the bidders are keen to get back at it. And so, and it'll employ many thousands of people in terms of construction, and the spillover benefits for that particular project would be, in terms of the economic uplift and development, quite huge. A number of developments were curtailed as a result of the cancellation that I think can come back to life once the once the approval is brought back forward again. So I anticipate there will be active discussions between the federal, provincial, and municipal governments, and private sector, I should say, to look for a path forward on that. But I mean, that predates the COVID issues. You know, there are many capital projects that we have on the books already, and our argument with our federal partners is you don't have to look very far for capital projects that can get started, you know, right away. They're already in our capital budgets, and so we can define those fairly easily relative for the COVID stimulus. And you know, once we get the go-ahead to say, you know, look for those projects and bring us a list, we can very easily go to our 10-year capital budget and bring forward a lot of projects that will get people to work immediately. And so there's going to be no difficulty in doing that. Now, whether they be, I believe they ought to be higher order infrastructure projects, you know, not bocce courts or playgrounds or, you know, or swing sets or splash pads. This needs to be, you know, part of the backlog of infrastructure deficit that we already have that we can fill in a hurry.
All right, thank you.
You're welcome.
Next question goes to Lisa from CHML. Lisa, go ahead.
Hi, thanks very much for taking my questions. This one, I guess, is for Dr. Richardson. In terms of the DriveThru clinic, I know it's just launching this weekend. Do you have any details at this point about expanded hours, what those might be following Sunday?
Thanks very much. Right now, we've got it booked for 11 to 3 on Friday, Saturday, and Sunday. We're still working on what this is going to look like for Monday, starting on Monday. So we'll get those out to you as soon as we have them, but we haven't got those nailed down yet, and we don't want to we want to make sure you get the accurate information once it's done.
Okay, no problem. Thanks. And my other question is for Paul Johnson, just about in terms of the supports for the city's homeless. I know last weekend the big news was that First Ontario Centre was becoming an overflow shelter for Hamilton's homeless men. Are there any kind of plans to do something similar for the homeless women and children and families in the city as well? I know there's not exactly the same amount of space, but I just wondered if anything might be in the works.
So we started on that plan earlier, and I've been utilizing hotel space primarily from a women and families perspective. And so quite a number of families were already, and part of the reason is we've been using hotels in the women's system for a while. One of the challenges is our women's and our family system for homelessness is well over 100% almost all the time. So we've been using those. We continue to use those avenues and opened up more spaces within those hotels. So that's really been a bit of the overflow there. And we've also been working at looking at some housing options so we can move people directly into housing. So at this stage, no real push to open up another physical space in terms of a new shelter. We're utilizing those hotels that we procured along the way in the early stages.
Okay, thank you very much.
Next question is to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Hi, my question is for Dr. Richardson, and it's regarding Emmanuel House. I'm wondering how many staff now in total have tested positive, and if any residents, including any who've recently passed away, tested positive.
Hi, Katrina. There's 5 staff in total now that have tested positive. 2 of those are new today, and there are 2 residents that are confirmed positive at this point.
Thank you. And those 2 residents, they are residents who are still residing at the facility. Is that right?
I don't have anything specific on them, and I probably couldn't tell you anyway because of privacy.
Okay, thank you.
Next question goes to Matthew from the Hamilton Spectator. Matthew, you can go ahead.
Hello. Hi. Sorry, can you hear me?
Yes, we can. Go ahead.
Okay, sorry. I'm not sure if this is to the mayor or to Paul, but I'm just looking for some details around what is happening with your part-time workers, whether it's a layoff or an emergency leave, and how many and when they will be affected.
The effective date is, I believe, May the 4th. We're not scheduling hours, so it's technically not a layoff. So they're eligible to come back should we come through this pandemic period, and the need is going to be there. But they're largely folks that earn part-time wages and may very well be better off on the Canadian Employment Replacement Bank funding that the government has put forward. So they've all been notified. It's a very difficult decision to make, but the reality is we have nothing for them to do at the moment. They'd likely be school crossing guards or clerks in the swimming pools, et cetera, that kind of employment, soupies. So we're going to hopefully bring them back when we're back to some semblance of normality, that we can utilize all of their services again. Valued employees, for sure. Difficult decision to make, but the reality is they're going to have to look at the benefits that the government's putting forward, and we're going to give them all the assistance required to make sure that they get the benefits they deserve.
Okay, and sorry, as a follow then, we had just heard from someone who had mentioned that they understood themselves to be laid off. So I don't know if that's if it's simpler to explain it that way or not. But do you have some layoffs and some people on leave, or?
No. So the layoffs that we did do were casual employees, winter relief casual employees that were normally laid off this time of year. They've already been laid off, and that happened a number of weeks ago. That happens seasonally every year, notwithstanding. This is not considered technically to be a layoff. We're not scheduling hours for them, so they won't be working, but they're eligible to apply to get the federal benefits and potentially for some of them EI benefits as well, so they can continue to get resources into their pockets to continue to pay their bills.
And we'll just check if there's anybody else on the line that we didn't get to yet. And with that, I'll pass it back to you, Mr. Mayor.
Great, thank you. I need to get my phone back up and running here. Thank you very much, and thank you all for the questions, and thank you to the media for continuing to share this information in the broader community. The community is doing a terrific job, and I think part of the reason for that is that they're getting good information and have a complete understanding as to why all of these changes are being made, and hopefully an understanding that almost daily things change as well. So we keep adjusting as we go. Because this is not a scenario that anyone has planned for or is trained for beyond the broader pandemic issues, but in terms of this large and broad an issue, not only locally but nationally and globally, is beyond a doubt unprecedented. So I thank the media for continuing to share the ongoing information. The thank yous to our two sign language experts, the American Sign Language experts, Rosalie Vizers and Georgia Whalen, who every time out share all of this with those that are deaf. And thank you so very much for your work. And of course, we thank our essential service workers out there, the paramedics, the healthcare workers, police officers, grocery store workers, pharmacists, truck drivers, cleaning staff, bus operators, food manufacturers, firefighters, and all the other imperative frontline workers that are putting themselves out there every day to keep our city functional, to keep the groceries on the shelves, to make sure that the healthcare system functions and they're getting the care they need. I mean, it is an impressive effort, and we thank them all for that effort, and we encourage you to be patient, especially with the grocery store clerks and the pharmacy clerks. They tend to get a hard time from people because people have to wait longer now, unfortunately. But most people are okay with that. Some people are not. But you don't need to be taking it out on the grocery store clerks that are just there to do the job to make sure that you get the resources you need. If you want to take it out on someone, give me a call. I'll take all of your complaints. The website, if you want to call me, by the way, 905-546-4200. I'm happy to run a complaints line. And I know these are difficult issues and difficult times, but the vast majority of our population understands that, and you're all doing the right thing. Again, the hamilton.ca/coronavirus website for all of the resources you might need. And the Invest in Hamilton website and the hometownhub.ca website for the business community and for services that you might still need but want to get them online. There are about 300 companies that are dialed into the Hometown Hub that you can get access to for various needs. So feel free to lock in there and look to see if you can get anything online locally that's still available to you and support our local businesses. Last two issues is our mental health issues continue to be a challenge now more so than ever. There is help for you, 905-972-8338 is the help phone line for Coast for mental health issues for anyone out there in the broader community, and specifically for kids. And a number of children in our community are in difficult circumstances or are also having mental health issues or challenges and need someone to talk to. Text 686868 or telephone 1-800-668-6868 or get on the kidshelpphone.ca website, and help is there for you, and all you need to do is connect. One more time, donating blood. Critical surgeries are still happening very actively, and blood services are still required. So if you are able to donate blood, please reach out to your blood.ca local clinic and provide that resource. It's very much needed out there, and be very much appreciated if you continue to contribute. And it is Orthodox Easter for many in our community, so happy Easter. By the same breath, we wish you a great celebration, but we ask you to do it separately from your own homes or through technological means, a telecast or broadcast service, some way of still celebrating, but not gathering in groups larger than 5, and certainly maintaining that spatial difference or spatial separation that you need to continue to do. And lastly, as a reminder to all the churches out there that have been doing this and others that may, Wednesdays and Sundays at 6 p.m., ring your church bells in appreciation for all of the frontline healthcare workers, first responders, everyone keeping our city cared for, safe, and fed during this pandemic. It is a great testament to the great appreciation that we all have for the great work that they're doing in our community. And on that note, we wish you all a great weekend. Happy Easter in the Orthodox community. Continue to do what you're doing. You're doing a terrific job, and we will see you on Monday for a further update. Thank you.